Welcome to the deep dive. Usually when we talk about a medical diagnosis on here, there's this expectation of like precision. It feels almost like engineering, you know?
Oh, cool.
Like if you take a bad fall and your arm swells up, you get an x-ray. It shows that jagged white line and the doctor just points at the screen and says, well, there it is. That's the problem.
Right. It's binary. It's
Yeah.
either broken or it's not broken. And I think we find a great deal of comfort in that kind of clinical visibility.
Yeah, exactly.
We really like our ailments to be easily categorized,
Yeah.
easily measured, definitively proven.
We want the proof. But then you step into the world of female sexual dysfunction, and suddenly that pristine X-ray machine is just completely useless. We're looking at a diagnostic landscape that is, honestly, it's incredibly murky.
Murky is the perfect word for it.
There's no, like, standard blood test you can take for low sexual desire. There's no MRI scan that can pinpoint the cause of an elusive orgasm.
No, it is the absolute definition of diagnostic muddy waters. Because female sexual response is this profoundly complex interplay of hormones, vascular health, neurology, and frankly, psychology.
No, it's all tangled up together.
Exactly. And because it is so subjective and historically, let's be honest, dismissed or marginalized by the broader medical establishment, it creates this environment where patients are just left entirely on their own. They're searching for answers in the dark.
And that reality brings us to the central, really provocative question for today's deep dive. For those of you listening, we're exploring this. Can an injection of your own spun-down blood, a procedure commonly marketed as the O-shot, actually make your orgasms stronger?
It's a huge question, and it's one generating a massive amount of mainstream attention right now. And not coincidentally, it's generating a staggering amount of money, too.
Oh, massive amounts. And the sources we have stacked up in front of us today trying to answer that question are wildly polarized. On one hand, we're looking at these clinical pilot studies pulled from medical journals, like the Turkish Journal of Obstetrics and Gynecology and Curious.
Right.
And these papers are claiming massive, life-changing success for women struggling to climax. But then, stacked right next to those optimistic studies, we have these fierce, unsparing takedowns from prominent gynecologists.
And regulatory warnings, right?
Yes, formal FDA warnings.
Right.
Strongly worded statements from aesthetic surgery watchdogs basically telling patients to run the other way. It is a true battlefield of information.
So our mission today is to make sense of that battlefield for you. Female sexual dysfunction, or FSD, it affects over 40% of adult women at some point in their lives.
Wait, 40%? That's almost half the population.
Exactly. Let that number sink in.
Yeah.
Nearly half. Yet it remains chronically underreported and deeply undertreated because of the stigma attached to it.
Wow.
So we're going to cut through the marketing hype today. We'll look past the controversy and show you exactly what the clinical data says, what the medical critics are screaming about, and what it all means for you in the absolute wild west of women's sexual wellness.
Okay, so let's start by unpacking the actual procedure, because before we can even argue about whether or not this intervention works, we really need to understand exactly what is happening in the exam room.
We do, yeah. The mechanics are important.
The mechanics are intense, and for anyone listening who is considering it, you need to know what you're actually signing up for.
The foundation of the O-shot rests on a biologic material called platelet-rich plasma, or PRP.
Right. So according to our sources, you walk into the clinic and the whole process starts with a standard routine blood draw from your arm, just like at an annual physical.
Totally standard.
They take that vial of your blood and place it into a machine called a centrifuge. And this machine, it spins the vial at thousands of revolutions per minute.
Right, which separates everything.
Yeah, the gravitational force separates the heavy red blood cells, which sink to the bottom, from the plasma and the platelets, which rise to the top. So you're left with this concentrated, yellowish golden fluid. That is the platelet-rich plasma.
And that's where the prep ends and the real procedure begins. After that, the practitioner applies a heavy topical numbing cream to the genital area.
Because this is where the intervention gets highly specific and, honestly, incredibly invasive.
Extremely invasive. Using a very fine needle, the doctor takes that spun-down golden plasma and injects it directly into the clitoris.
The sources actually mention that they often do this at multiple points, injecting around the clitoral glands like the face of a clock.
Right. And then they administer another series of injections into the anterior vaginal wall, which is the internal tissue area, commonly referred to as the G-spot.
It's an intensely intimate, highly sensitive area to be introducing needles and fluid volume into.
Yeah.
I mean, the localized numbing cream is doing a lot of heavy lifting there.
Oh, absolutely.
But I have to pause here. and push back on the core concept. Because I know athletes use PRP all the time.
Yeah, sports medicine loves PRP.
Right. If a pro baseball pitcher tears a tendon or a marathon runner sprains an ankle, orthopedic doctors inject PRP into the joint to heal the torn, damaged tissue. But treating sexual dysfunction like a sports injury,
It's a leap.
it is. How does applying a quote-unquote healing plasma to an area that isn't technically broken or torn translate to stronger orgasms? I mean, human genitals aren't a sprained ankle.
No, they're not. But that is the exact conceptual leap the proponents of this procedure are asking you to make. And the biological hypothesis they're relying on is actually quite fascinating if you look at it.
Okay, let's hear.
Well, platelets are mostly known for clotting blood when you get a paper cut, right?
Hmm.
But they are also these tiny reservoirs packed with healing proteins. When you spin down that blood in the centrifuge, the resulting PRP has an incredibly high concentration of specific growth factors.
Like what kind of factors?
We're talking about compounds like VEGF, vascular endothelial growth factor, and EGF, epidermal growth factor.
So basically, these are the chemical messengers your body naturally sends out to a wound site to sound the alarm and say, hey, we have damage here, send the construction crew to fix this.
Exactly. And if that biological theory actually holds up, injecting those concentrated growth factors into the clitoris and the vaginal wall would effectively trick the body into launching a massive, localized regenerative response.
Wow, okay.
The hypothesis claims these injected factors trigger local stem cells to differentiate and multiply. Proponents believe it creates brand new blood vessels, a biological process called neovascularization.
New blood vessels, right.
And they claim it boosts collagen production to plump the tissue and actually regenerates and sensitizes the local nerve endings.
So the overarching equation they're selling to patients is more localized blood vessels plus denser sensory nerves equals heightened physical arousal, more natural lubrication, and much stronger, easier orgasms.
Precisely. They're claiming to structurally and functionally rejuvenate the genital tissue from the inside out, making the neurovascular network far more responsive to physical stimulation.
I mean, if that theory sounds like a medical miracle, the initial data from the clinical studies we're looking at, it paints a picture of massive, almost unbelievable success.
The numbers are definitely striking.
Let's dig into those numbers, because we have a study published in the Turkish Journal of Obstetrics and Gynecology. The researchers looked at 52 women who were formally diagnosed with sexual dysfunction, specifically orgasmic disorder.
Right. And they received 4 PRP sessions spread out over 4 months.
Yes. And the researchers measured the outcomes using this well-established, validated psychological tool called the Female Sexual Function Index, or FSFI.
Which is a very detailed questionnaire that scores different domains of a woman's sexuality. It measures desire, subjective arousal, natural lubrication, levels of pain during intercourse, and, of course, orgasmic function.
Right. So before the PRP injections even started, these 52 women had an average orgasm subscore of just 2.11 out of a possible 6. They were struggling significantly.
That's a very low baseline.
But after completing the 4 treatments, that average score jumped to 4.48. Their total overall sexual function scores essentially doubled.
Which is huge for a deeply subjective, notoriously difficult to treat experience like an orgasm. A jump from 2.11 to 4.48 is a statistically massive leap. It effectively pushed 50% of the women in that study out of the clinical dysfunction category entirely.
Wait, really? So they went from having a diagnosable medical issue to just falling into the normal range?
Exactly. And it's not just an isolated finding either. We reviewed an Egyptian study looking at 30 women that showed very similar leaps. Their orgasm scores jumped from 1.5 to 4.0.
Yeah, but the metric that really stood out to me in that particular study was the psychological relief.
The distress scale.
Right, the distress scale. They measured the emotional burden these women were carrying. And after the treatments, 83% of the women moved from being officially categorized as distressed about their sex lives to not distress.
That specific metric is so important because it highlights how heavy the emotional and psychological burden of female sexual dysfunction really is.
Yeah.
I mean, it impacts self-esteem, relationships, overall quality of life. Erasing that distress is a profound clinical outcome.
Absolutely. And we also have a pilot study from the journal Curious looking at 23 women. This protocol was slightly different, though. It combined the PRP injections with a hybrid CO2 laser treatment.
Right, a combo approach.
And the results showed a 35.4% improvement in orgasmic frequency. And for the women in the study experiencing moderate to severe pain during sex, a condition called dyspareunia, 80% of them reported significant pain relief. Some even said the pain vanished entirely.
Yeah, the laser component in that study is designed to cause controlled microscopic thermal injuries to the vaginal tissue. Think of it similarly to microneedling on your face.
Oh, like when they damage the skin to make it heal smoother.
Exactly. The idea is that creating tiny controlled damage works synergistically with the regenerative PRP to supercharge the body's collagen production and tissue remodeling.
Okay, but here's where I have a huge question. If the numbers are practically doubling across the board for desire, lubrication, and orgasm, and women are going from actively distressed to completely cured, why isn't this standard medical care?
That's the million-dollar question.
Like, why isn't every single gynecology office in the country offering this procedure right alongside a routine pap smear?
Well, when we pull back and look at the broader picture of clinical research, those impressive numbers come with massive glaring asterisks. We have to look critically at how these studies were actually designed.
Okay.
These are what the medical community calls pilot studies. They're exploratory. They involve very small sample sizes. We're talking 30, 50, or just 23 people.
So they aren't tracking thousands of women over several years.
Not at all. But the most critical flaw in these papers, the specific thing that keeps the O shot out of standard insurance-covered medical care, is the complete lack of a randomized placebo-controlled group.
Ah.
In none of these studies did the researchers take half the women, inject them with a harmless saline solution instead of PRP, and see if the mere act of getting the injection caused the improvement.
And the placebo effect is notoriously strong in medicine generally, but especially in anything related to human sexuality.
It is incredibly powerful. The human sexual response is not just a hydraulic mechanical system. It relies on a delicate balance of physical stimulation and psychological permission.
Right, the mental aspect is huge.
Huge. And the researchers in these very studies openly admit this limitation. Because of how deeply a woman's mindset influences her sexual satisfaction, a profound placebo effect absolutely cannot be ruled out here.
I guess that makes sense.
Just consider the clinical environment. A patient goes to a specialized clinic. She pays intense attention to her own body and her sexual needs. She receives a highly medicalized, intimate intervention from an authority figure in a white coat who confidently promises her it will help.
So you're saying that psychological expectation alone, like the sheer validation of her problem, can dramatically improve her physical experience in the bedroom.
Exactly. We have a situation where desperate patients are seeing real, measurable improvements in their lives, but the data simply isn't rigorous enough to prove that the spun-down plasma is actually doing the biological heavy lifting.
And that lack of rigorous placebo-controlled data is exactly where the broader medical community steps in, and why they're reacting with such hostility.
Hostility is right.
While these small pilot studies are celebrating, a very vocal, highly credentialed segment of the medical establishment is sounding the alarm, and to the skeptics, and they do not hold back.
No, they really don't.
We reviewed a searing critique from Dr. Jen Gunter. She's a highly prominent gynecologist and author who writes a publication called The Vagenda. She does not mince words regarding this procedure. She outright calls the O-shot an untested scam.
A scam. Yeah, Dr. Gunter attacks the very core of the biological premise we discussed earlier. Her argument is that the underlying biology of the O-shot is fundamentally flawed.
Because she points out that the body's natural healing process doesn't magically upgrade your tissue to give you supercharged orgasms.
Her analogy for this is just brilliant.
It really is.
Yeah.
She notes that if releasing growth factors and cytokines into the pelvic region was all it took to permanently heighten an orgasm, then women who recover from regular clitoral or vaginal surgeries would become superhuman in bed.
Which they don't.
Right. When a woman has a vaginal tear during childbirth or undergoes an episiotomy, her body naturally floods that exact area with massive amounts of those exact same healing factors to repair the surgical wound.
But clinical observation of post-surgical healing in the genital area does not show spontaneous, magical improvements in a woman's orgasmic capacity. Often, the exact opposite is true. There's a long period of numbness or pain.
Yeah, that's a really good point.
So if the body's own massive systemic healing response to a scalpel or a tear doesn't create better orgasms, it is biologically implausible that a tiny, isolated injection of spun-down plasma would do it. It's a gaping logical hole in the foundation of the procedure.
And when you start looking at the origins of the O-shot itself, the red flags just keep piling up, because the term O-shot isn't some general anatomical or medical term. It is a registered legal trademark owned by one specific physician. Dr. Charles Runels.
Right. And this brings us to a crucial intersection of modern medicine and aggressive commerce. When
Yes.
you look closely at the foundational evidence supporting his trademark, it is incredibly shaky. The sources note that Dr. Runel's initial pilot study, claiming massive success for the O-shot, was published in a journal managed by a company called OMICS.
Which, for listeners who aren't steeped in the politics of medical academia, OMICS is what is known as a predatory publisher.
A pay-to-play operation. In the traditional scientific method, when a researcher writes a paper, it's submitted to a journal where independent experts in the field anonymously review the work.
They check the math, the methodology.
Exactly. They look for flaws or bias before it is ever published. And importantly, the researcher doesn't pay those reviewers. Predatory journals completely flip that model.
So you just write a check and they print your paper online.
Yes, entirely bypassing that rigorous independent peer review. It allows someone to buy the credibility of a published scientific paper without actually surviving the scrutiny of the scientific community. You can essentially publish a shiny marketing brochure and call it medical literature.
Wow. And the sources also highlight that Dr. Runels himself has a highly controversial history. He was actually formally disqualified as a clinical investigator by the FDA.
Which is a big deal.
It means he's barred from running clinical trials involving experimental drugs or devices. He's also faced disciplinary action from his own state medical board in Alabama regarding his clinical practices.
But despite all of that regulatory friction and the lack of peer-reviewed data, this procedure has just exploded in popularity. It's available in aesthetic clinics and med spas all over the world.
Which means we really need to talk about the financials here. This procedure is considered experimental, so it is never covered by health insurance. According to our sources, a patient walking into a clinic will pay anywhere from $1,500 to $2,500 completely out of pocket for a single O-shot.
That's a huge expense, and the revenue stream for the creator goes much deeper than just treating the individual patient in the exam room. To use the trademark name O-shot on a website or a billboard, local doctors and med spa owners have to pay a toll.
It sounds less like traditional medicine and more like a fast food franchise model.
That's exactly what it is.
The real profit isn't just selling the birther to the customer. The true passive income comes from squeezing licensing fees out of the franchise owners. Doctors pay nearly $1,000 to get trained by Dr. Runel's organization. Then they are required to pay a $97 monthly membership fee just to keep the legal right to use the trademark name in their marketing.
It's brilliant from a business standpoint.
I mean, if you have just 100 doctors paying that monthly fee, that is nearly $10,000 a month in purely passive income just for owning the word.
And medical critics argue this entire system is a highly effective SEO-driven marketing machine. By utilizing the trademark and a network of paying providers, they flood the internet with positive, search engine-optimized articles and testimonials.
Making it super hard for patients to find the real information.
Almost impossible. For an average patient Googling their symptoms, finding objective, critical medical information is buried under all that marketing.
Yeah.
And they are actively targeting the demographic women suffering from sexual dysfunction, who are historically underserved by traditional medicine and often incredibly desperate for any kind of help.
Yeah.
This aggressive commercialization is why organizations like the British Association of Aesthetic Plastic Surgeons, or BATS, and the FDA have issued formal warnings. They're sounding the alarm about the exponential rise of these heavily marketed rejuvenation procedures being pushed by non-specialists without large-scale, independent, randomized controlled trials to back up their claims.
Okay, but beyond the sheer financial risk of spending thousands of dollars out of pocket on what might just be a very expensive, cleverly marketed placebo,
Yeah.
we have to talk about the physical reality.
The physical risks are very real.
Right. What are the actual physical risks of having your genital tissue injected and lasered?
Well, whenever you intervene in a highly sensitive, incredibly complex neurovascular area like the clitoris, there is always an inherent physical risk.
Now, the PRP-specific studies we looked at, they claim the procedure is incredibly safe, specifically because it's autologous, meaning it's your own blood being injected back into your own body, so the risk of a severe allergic reaction or rejection is practically zero.
That is true for PRP alone.
And the immediate localized aftermath they describe in the text is mostly transient and mild. Patients might experience some minor spotting, a temporary feeling of vaginal fullness due to the fluid volume, or localized soreness for maybe 24 to 72 hours.
Right. But we cannot look at the O-shot in a vacuum.
Yeah.
because in practice, it is frequently bundled and marketed alongside transvaginal laser therapies and radiofrequency devices, exactly like the protocol we saw in the Curious study.
Okay, and that changes things.
Drastically. When you look at the broader, unregulated category of vaginal rejuvenation interventions, the safety profile gets significantly darker and much more alarming.
Yeah, we looked at an exhaustive clinical overview from NICE, the National Institute for Health and Care Excellence in the UK, and they documented some truly horrifying complications resulting from these types of thermal and rejuvenation interventions.
Really devastating stuff.
We're talking about patients who walked into a clinic hoping to fix a minor issue or just improve their sensation and ended up developing persistent, progressively worsening, painful intercourse.
Yeah, they developed dyspareunia that was objectively worse than before they ever sought treatment.
Exactly. The report details cases of severe vaginal lacerations occurring as soon as the women tried resuming normal intercourse. It documents chronic pelvic floor spasms. And there's one specific case study in the sources that just made my stomach drop.
Oh, the Scripture case.
Yes. A patient underwent a rejuvenation procedure and her body's healing response went completely haywire. She developed what the medical report called a crescent-shaped fibrous band mid-vagina. It physically impinged on the diameter of her vaginal canal, creating a partial obstruction and a severe stricture.
The intervention induced a massive buildup of thick scar tissue that fundamentally altered her pelvic anatomy.
I mean, a patient goes in hoping to fix some numbness or improve her orgasm and could literally end up with a fibrous band obstructing her vagina. That is terrifying to me.
It is terrifying. And this is exactly why mainstream medical authorities are demanding rigorous, long-term trials before this becomes standard care. The clitoris contains thousands of nerve endings, and the anterior vaginal wall is incredibly delicate.
So you really have to be careful.
You have to be. When a practitioner introduces needles, sudden fluid volume, or thermal laser energy into that tissue without decades of long-term safety data, they are quite literally rolling the dice with a woman's sexual future.
Sure.
You might trigger a positive, mild healing response. Or you might trigger severe scarring, permanent nerve damage, and chronic pain. We simply do not have the large-scale peer-reviewed data to promise these women's safeties.
Okay, let's summarize this incredibly messy reality we've unpacked for you today. On one side of this medical battlefield, you have women who are suffering from genuine, debilitating sexual distress.
Yes, very real suffering.
And they are participating in small pilot studies and reporting that when they get these PRP injections, their orgasm scores double, their pain decreases, and their emotional distress plummets. They feel heard and they feel healed.
But then on the other side of that exact same battlefield, you have prominent medical experts, gynecologists, and regulatory bodies waving massive red flags.
Red flags everywhere.
They're pointing to a biological theory that just does not hold up to basic physiological scrutiny. They're pointing to a trademark owner with a sketchy regulatory past who relies on predatory pay-to-play journals. And they're highlighting a franchise-style financial model that profits off vulnerable women, all while pointing out a severe, glaring lack of large-scale, placebo-controlled evidence to prove this entire industry isn't just an expensive, potentially dangerous illusion.
Wow. We want to leave you with something to really mull over, though. A final thought that attempts to bridge this massive gap between the harsh clinical data and the very real human experience of the women seeking this out.
Because if a 30-person study shows a genuine, life-changing improvement in a woman's ability to achieve an orgasm, but the top doctors in the field categorically state the biological science behind the injection is total nonsense, could the mere ritual of the procedure be the actual cure?
That's a fascinating thought.
Think about the power of that environment. An expensive, highly medicalized intervention performed by an authority figure who looks you in the eye and confidently promises you that your sexual pleasure matters, that it isn't just in your head, and that it can be fixed. Could that profound, tangible act of validation serve as the ultimate psychological placebo for female sexual dysfunction?
It really makes you wonder. If the human mind is powerful enough to heal your sexual distress simply because you deeply believe the treatment works, does it actually matter to the patient that it's a placebo?
That's the real question, isn't it?
If you finally get the physical and emotional relief you've been desperately looking for, do you care if the x-ray is blurry? Keep asking questions, keep digging. We'll see you on the next deep dive.